Hi, I'm Todd Curie, Director of the ICCHP, a clinical mind-body therapeutics training organization, teaching people from a variety of backgrounds in mind-body science and medicine. As we're faced with an unprecedented, difficult global situation, the ICCHP wanted to make a contribution. So I decided to put together an initiative to address some of the issues that we are facing as a result of this global pandemic. At the ICCHP, we have developed a therapeutic hypnosis and mindfulness healing support protocol for patients suffering from COVID-19. This protocol helps alleviate the huge stresses that people suffering from coronavirus experience, and in doing so helps to stimulate their immune systems, thereby enhancing the body's self-healing mechanisms. The initiative started following my reading of a research study from the Hainan General Hospital in Wuhan, China, where they conducted a randomized controlled clinical trial on patients in isolation suffering from COVID-19 infection. And this was done in January and February of this year. Some of the issues that these patients experience have to do with difficulty sleeping and a heightened level of anxiety associated with having the infection, being in isolation. Also, as the virus symptoms affect the respiratory system, the use of drugs like benzodiazepines and also pain medication such as opiate-based pain medication, these types of treatments are not appropriate for these patients because these medications also reduce the respiratory capacity. And so they have to find other ways of working with these patients in supporting them during the infectious period and the period in isolation. So what the researchers did is they took a group of patients and taught them a progressive relaxation technique to help them to sleep and to help them reduce their anxiety. And when they compared the group where they taught them relaxation techniques to the control sample of those patients not receiving the relaxation intervention, the researchers showed that the intervention worked, reducing anxiety and improving sleep. So this got me thinking, because of my area of specialty and experience in mind-body medicine, as well as my previous professional experience in communicable diseases, using therapeutic hypnosis in relaxation techniques and mindfulness-based relaxation processes, along with mind-body healing processes, there is a possibility that we can build on this valuable research that was conducted in Wuhan, China. Prior to setting up the ICCHP, my own background was in communicable diseases. I trained in preventive medicine and infectious disease control at the USAF School of Aerospace Medicine, and I worked for 6 years as a communicable disease specialist in a hospital clinical setting. For the past 20 years, my interest has been in mind-body medicine, and I've been in private clinical practice in London since 2013. I currently teach clinical therapeutic hypnosis and mind-body processes to medical students in UK medical schools. So I have a wealth of knowledge and understanding of the situation that we're facing. So myself and Dr. Alex Taylor, our research advisor at the ICCHP, who has many years experience researching mind-body physiology and mind-body medicine, we've come up with a proposal and a protocol that we feel will provide support to help not only those that are infected with COVID-19, but also those that maybe have a risk of infection, maybe family members, carers, frontline healthcare workers, support workers, anybody who has the potential of exposure. Also, anyone else that may be self-isolating at the moment, whether they have symptoms or no symptoms, whether they've been diagnosed or not diagnosed with the virus, or really anyone who is anxious about being exposed to infection. It's a general protocol, so it can be used to support the body's natural healing response and boost one's own immune system as well, and can be used by anybody safely. So the initiative we've taken is to put together a mindfulness-based therapeutic healing support recording and make it available worldwide to anyone who wants to listen to it free of charge. Feedback from listeners who have used it say that it has helped them to relax and sleep, and some even reported feeling well-being after its use. This is one part of the initiative, with the hope that we can offer some support to people around the world. The ICCHP team members are made up of other clinicians, counselors, psychiatrists, psychologists, and other clinically trained professionals, all wanting to offer what we can to help at this difficult and challenging time. Our team in Malaysia set up a psychological first aid program to help support frontline medical practitioners and first responders, and this was in conjunction with the psychology team at the Wawasan Open University. Our team in Singapore has taken our proposal and our protocols, translating them into Mandarin, which has allowed us to reach out to the research teams in Wuhan and other areas of Asia. Another part of the initiative is with the therapeutic clinical protocol proposal to the global healthcare community, in case there are any clinical researchers interested in building on this research that was done in Wuhan, China, or maybe implement a mind-body therapeutic protocol within their own clinical settings. This ICCHP initiative is our contribution to promote and support mind-body health and well-being worldwide. So if there's anyone in the healthcare community who would like to reach out to us for further information, then please visit our website, www.icchp.com, for further information. And anyone wanting to listen to the mind-body healing mindfulness recording, you'll find the link on our website. Thank you very much for your time.